In clinical practice, bananas are often recommended as a healthy fruit due to their rich nutrient content, easy digestibility, and cardiovascular benefits. However, for older adults, especially those with underlying health conditions, consuming bananas, particularly ripe ones, should be approached with caution. The first major concern is their high potassium content. Potassium plays a vital role in regulating heart rhythm and blood pressure. However, in older individuals with reduced kidney function, the body's ability to excrete excess potassium is impaired. This can lead to a condition known as hyperkalemia, where potassium levels in the blood become dangerously high. Symptoms may include muscle weakness, fatigue, and in severe cases, life-threatening cardiac arrhythmias. Secondly, ripe bananas contain a significant amount of natural sugars, primarily glucose and fructose, which are rapidly absorbed into the bloodstream. This can cause a sharp increase in blood sugar levels after consumption. For older adults with diabetes or prediabetes, uncontrolled intake of bananas may lead to blood sugar fluctuations, increasing the risk of complications such as vascular damage, nerve disorders, and cardiovascular disease. Bananas may also impact digestion if not consumed appropriately. Some older adults with sensitive digestive systems may experience bloating or discomfort, particularly when bananas are eaten on an empty stomach or in excessive amounts. This can interfere with overall digestion and nutrient absorption. From a medical perspective, bananas do not need to be completely eliminated from the diet, but they should be consumed in moderation. Healthy older adults may safely eat about 1 banana per day. However, those with kidney disease, diabetes, or those taking heart-related medications should consult a healthcare professional before including bananas regularly in their diet. In conclusion, while bananas are nutritious, they are not universally suitable in unrestricted amounts. Understanding one's health condition and adjusting dietary habits accordingly is essential for older adults to maintain stability and prevent serious health complications. Ripe mangoes are often considered a delicious and nutritious fruit, widely appreciated for their rich flavor and high vitamin content. However, from a medical perspective, their consumption in older adults, especially those with underlying health conditions, should be carefully moderated to avoid potential adverse effects on the body. The primary concern with ripe mangoes is their high sugar content. As mangoes ripen, their starch converts into simple sugars such as glucose and fructose, significantly increasing their glycemic impact. Once consumed, these sugars are rapidly absorbed into the bloodstream, leading to a sharp rise in blood glucose levels. For older adults with diabetes or prediabetes, this can result in poor glycemic control and increase the risk of complications such as vascular damage, kidney disease, nerve impairment, and cardiovascular issues. In addition, ripe mangoes are often associated with heat-producing effects in traditional dietary understanding. Clinically, excessive consumption may lead to symptoms such as a sensation of internal heat, dry mouth, mild constipation, or skin breakouts. Older adults, particularly those with sensitive digestive systems, may experience these effects more noticeably, leading to discomfort and reduced overall well-being. Another important consideration is weight management. Due to their high natural sugar and calorie content, frequent or excessive intake of ripe mangoes can contribute to increased caloric consumption. In older adults, unintended weight gain can reduce mobility and elevate the risk of conditions such as hypertension, dyslipidemia, and heart disease. Furthermore, some individuals may experience mild allergic reactions to mangoes, including itching of the mouth, lips, or throat irritation. While relatively uncommon, such reactions can be more concerning in older adults with heightened sensitivity. From a clinical standpoint, ripe mangoes do not need to be completely avoided but should be consumed in moderation. Healthy older adults may safely eat small portions, such as a few slices per day, preferably after meals to minimize rapid blood sugar spikes. Those with diabetes or metabolic disorders should exercise greater caution and consult a healthcare provider before including mangoes regularly in their diet. In conclusion, while ripe mangoes offer nutritional benefits, they can pose health risks if consumed improperly. Careful portion control and an understanding of individual health conditions are essential for older adults to enjoy this fruit safely without compromising their health. In clinical practice, grapes are often recognized as a nutrient-rich fruit, known for their antioxidant properties and potential cardiovascular benefits. However, for older adults, especially those with underlying health conditions, grape consumption should be carefully moderated to prevent unwanted health effects. The primary concern with grapes is their high sugar content. Grapes contain significant amounts of glucose and fructose, which are simple sugars that are rapidly absorbed into the bloodstream. This gives grapes a relatively high glycemic impact. When consumed in large quantities, they can cause a rapid spike in blood sugar levels. For older adults with diabetes or prediabetes, this can make blood glucose control more difficult and increase the risk of complications such as vascular damage, kidney dysfunction, cardiovascular disease, and peripheral neuropathy. In addition, grapes may affect the digestive system if not consumed appropriately. Some older adults with sensitive digestion may experience bloating, gas, or mild diarrhea after eating grapes, particularly when consumed on an empty stomach. The high sugar content can ferment in the intestines, producing gas and discomfort. Furthermore, grape skins and seeds, if not removed, may be harder to digest, especially in individuals with weakened gastrointestinal function. Another important factor is the potential for weight gain. Although grapes are natural, their calorie content, primarily from sugar, is not insignificant. Frequent or excessive consumption may contribute to increased caloric intake. In older adults, weight gain can reduce mobility and elevate the risk of conditions such as hypertension, dyslipidemia, and heart disease. Additionally, in rare cases, grapes may trigger mild allergic reactions or interact with certain medications, particularly those related to cardiovascular health or blood clotting. While uncommon, this is an important consideration for older adults who often take multiple medications. From a medical standpoint, grapes do not need to be completely avoided, but portion control is essential. Healthy older adults may consume a small portion, such as 5 to 10 grapes per serving. Those with diabetes, digestive issues, or who are taking specific medications should consult a healthcare professional before including grapes regularly in their diet. In conclusion, while grapes offer nutritional benefits, they can pose health risks if consumed excessively or without consideration of individual health conditions. Moderation and personalized dietary choices are key to maintaining health and preventing complications in older adults. In nutritional counseling, pineapple is often appreciated for its refreshing sweet tart flavor and high vitamin C content. However, from a medical perspective, pineapple is not suitable for everyone, especially older adults with sensitive digestive systems or underlying gastrointestinal conditions. The primary concern with pineapple is its high natural acid content. When consumed, particularly on an empty stomach, this acidity can irritate the stomach lining and stimulate gastric acid secretion. For older adults with gastritis, peptic ulcers, or gastroesophageal reflux disease, GERD, pineapple may worsen symptoms such as upper abdominal pain, heartburn, nausea, and indigestion. In addition, pineapple contains a potent digestive enzyme called bromelain, which helps break down proteins. While beneficial in some contexts, bromelain can also irritate sensitive tissues. Older adults may experience a burning sensation on the tongue, mouth irritation, or mild inflammation of the oral mucosa, especially when consuming large amounts or unripe pineapple. Another factor to consider is pineapple's impact on blood sugar levels. Although it is not as sweet as some fruits, pineapple still contains a notable amount of natural sugar. When consumed in excess, particularly in juice form, it can lead to a rapid increase in blood glucose levels. This can be problematic for older adults with diabetes or impaired glucose metabolism. Furthermore, pineapple may trigger allergic reactions in certain individuals. Symptoms can include itching of the mouth, swelling of the lips, or throat irritation. While relatively uncommon, such reactions should not be overlooked in older adults with heightened sensitivity. From a clinical standpoint, pineapple does not need to be completely avoided, but it should be consumed carefully. Healthy older adults may eat moderate portions of ripe pineapple, as ripening reduces acidity and irritation. It is also advisable to consume pineapple after meals rather than on an empty stomach to minimize gastric discomfort. In conclusion, while pineapple offers nutritional benefits, it can pose health risks if consumed improperly. Adjusting portion size, timing, and considering individual health conditions are essential steps to ensure safe and beneficial consumption for older adults. Oranges and tangerines are commonly regarded as healthy fruits due to their high vitamin C content and immune-boosting properties. However, from a medical perspective, consuming citrus fruits requires caution in older adults, especially those with gastrointestinal conditions or sensitive digestive systems. The primary concern lies in their high citric acid content. When consumed, particularly on an empty stomach. This acid can irritate the stomach lining and stimulate gastric acid secretion. In older adults, the stomach lining is often more vulnerable due to age-related changes, making it more susceptible to irritation. This can lead to symptoms such as upper abdominal discomfort, heartburn, bloating, and in more severe cases, worsening of gastritis, peptic ulcers, or gastroesophageal reflux disease, GERD. Another important factor is timing. Many individuals drink orange juice early in the morning on an empty stomach, believing it to be a healthy habit. However, this practice can strongly irritate the stomach, especially in older adults. Additionally, consuming citrus fruits or juices late at night may increase the likelihood of acid reflux when lying down, which can disrupt sleep quality and cause discomfort. Although oranges and tangerines are not excessively sweet, they still contain a moderate amount of natural sugar. When consumed as juice, the fiber is removed, allowing sugars to be absorbed more rapidly into the bloodstream. This can lead to spikes in blood glucose levels, which is not ideal for older adults with diabetes or metabolic disorders. Furthermore, the acidic nature of these fruits can affect dental health. Older adults often experience enamel erosion over time, making their teeth more sensitive. Frequent exposure to acidic foods like citrus fruits can worsen tooth sensitivity and contribute to further enamel damage. From a clinical standpoint, oranges and tangerines do not need to be eliminated from the diet, but they should be consumed appropriately. Older adults are advised to eat them after meals rather than on an empty stomach. It is also preferable to consume whole fruit instead of juice to retain fiber and slow down sugar absorption. In conclusion, while citrus fruits provide valuable nutrients, improper consumption can negatively affect digestive health and overall well-being in older adults. Careful attention to timing, portion size, and individual health conditions is essential to ensure safe and beneficial intake. Watermelon is often considered a refreshing and hydrating fruit due to its high water content and mild sweetness. However, from a medical perspective, its consumption in older adults, especially those with underlying health conditions, should be carefully managed to avoid potential negative effects on the body. The primary concern with watermelon is its high glycemic index, GI. Although it does not taste overly sweet, the sugars in watermelon are rapidly absorbed into the bloodstream. This can lead to a sudden spike in blood glucose levels after consumption. For older adults with diabetes or prediabetes, uncontrolled intake may result in significant blood sugar fluctuations, increasing the risk of complications such as vascular damage, kidney dysfunction, and cardiovascular disease. Another important factor is watermelon's diuretic effect. Composed of over 90% water, it can increase urine production. In older adults, particularly those who already experience frequent urination or nocturia, nighttime urination, consuming watermelon, especially in the evening, may worsen symptoms. This can disrupt sleep quality and negatively impact overall health and daily functioning. Additionally, watermelon is considered a cooling food. In practice, Many older individuals with sensitive digestive systems may experience abdominal discomfort, bloating, or mild diarrhea after consuming watermelon, particularly if it is eaten cold directly from the refrigerator. The aging digestive system is often more sensitive to temperature and food properties, making such reactions more likely. Excessive consumption over time may also contribute to weight gain. While watermelon is low in calories per serving, its sugar content can add up when consumed in large quantities. In older adults, weight gain can reduce mobility and increase the risk of conditions such as hypertension, dyslipidemia, and heart disease. Another concern is food safety. Pre-cut or improperly stored watermelon can easily become contaminated with bacteria. Older adults, who may have weaker immune systems, are at higher risk of foodborne illness if they consume contaminated fruit. From a clinical standpoint, watermelon does not need to be completely avoided but should be consumed in moderation. Older adults are advised to eat small portions, avoid consuming it late in the evening, and refrain from eating it when it is too cold or when experiencing digestive discomfort. In conclusion, while watermelon can be beneficial when consumed appropriately, it may pose health risks if not properly managed. Adjusting portion size, timing, and considering individual health conditions are essential for safe consumption in older adults. Apples are widely regarded as one of the healthiest fruits due to their high fiber content, vitamins, and antioxidants. However, from a medical perspective, consuming apples, especially when done improperly, can pose certain risks for older adults. One of the primary concerns is pesticide residue on the skin. During cultivation and storage, apples are often treated with pesticides and preservatives to maintain their appearance and shelf life. If not thoroughly washed or peeled, these chemical residues can enter the body. In older adults, liver and kidney function may decline with age, reducing the body's ability to eliminate toxins. Over time, accumulation of these substances may negatively impact overall health. Another issue is digestive discomfort. Apples, particularly those that are firm or not fully ripe, contain a significant amount of insoluble fiber. For older adults with sensitive digestive systems, this type of fiber may lead to bloating, gas, or intestinal discomfort. Additionally, consuming apples on an empty stomach may cause mild irritation due to their natural acidity. Chewing can also be a challenge. Many older adults experience dental issues such as weakened teeth, dentures, or gum disease. Eating raw apples may be difficult, increasing the risk of inadequate chewing or even choking. This not only affects digestion but also poses a safety concern. Although apples generally have a lower glycemic impact compared to many other fruits, they still contain natural sugars. When consumed in large quantities, especially in the form of juice where fiber is removed, apples can lead to a faster rise in blood glucose levels. This is particularly relevant for older adults with diabetes or metabolic disorders. Temperature is another factor to consider. Eating apples directly from the refrigerator may cause tooth sensitivity or stomach discomfort in older individuals, as their digestive systems are often more sensitive to cold foods. From a clinical standpoint, apples remain a healthy option when consumed properly. Older adults are encouraged to choose ripe, softer apples, peel them if the source is uncertain, or cook them to improve digestibility. Portion control and alignment with individual health conditions are essential. In conclusion, while apples are nutritious, they are not entirely risk-free when consumed improperly. Selecting safe sources, preparing them appropriately, and moderating intake can help older adults benefit from apples without compromising their health. Guava is commonly regarded as a highly nutritious fruit, rich in vitamin C, fiber, and beneficial for immune health. However, for older adults, especially those with sensitive digestive systems or dental issues, guava consumption should be approached with caution to avoid potential adverse effects. The most notable concern with guava is its high content of coarse dietary fiber, particularly in unripe or firm fruit. While fiber is generally beneficial for bowel function, in older adults with weakened digestion, excessive intake can have the opposite effect. Consuming too much guava may lead to bloating, indigestion, and even constipation, especially if fluid intake is insufficient. Another important factor is the presence of guava seeds. These seeds are small, hard, and difficult to digest. In older adults, particularly those with gastrointestinal conditions such as colitis or diverticular disease, consuming large amounts of guava seeds may irritate the intestinal lining, leading to abdominal discomfort, digestive disturbances, or exacerbation of existing conditions. Chewing is also a concern. Many older adults have weakened teeth, dentures, or other dental problems. Guava, especially when firm, can be difficult to chew thoroughly. Inadequate chewing not only impairs digestion but also increases the risk of choking, a serious safety issue in elderly individuals. Although guava is not excessively sweet, it still contains natural sugars. When consumed in large amounts, especially repeatedly throughout the day, it may impact blood sugar control in older adults with diabetes. Additionally, eating guava on an empty stomach may cause mild gastric irritation due to its natural acidity. Older individuals with sensitive stomachs may experience discomfort or a burning sensation. From a clinical perspective, guava does not need to be completely avoided, but it should be consumed appropriately. Older adults are advised to choose ripe, soft guava, remove seeds if necessary, and eat it in moderate portions. It is also recommended to consume guava after meals and maintain adequate hydration to support digestion. In conclusion, while guava offers significant nutritional benefits, improper consumption may pose risks for older adults. Adjusting preparation methods and portion sizes according to individual health conditions is essential to ensure safe and beneficial intake. Pears are often considered a gentle, hydrating fruit that is easy to digest and beneficial for respiratory health. However, from a medical perspective, consuming pears, especially improperly, can lead to certain adverse effects in older adults. One of the primary concerns is their cooling nature. In clinical observation, many older adults with sensitive constitutions or weakened digestive systems may experience abdominal discomfort, bloating, or mild diarrhea after consuming pears, particularly in large amounts or when the digestive system is already compromised. Aging often reduces digestive efficiency, making it more difficult for the body to tolerate certain food properties. Another important issue is the consumption of cold pears directly from the refrigerator. Low temperatures can irritate the throat and respiratory tract. In older adults, especially those with a history of throat inflammation, bronchitis, or asthma, eating cold pears may trigger coughing, throat irritation, or worsen existing respiratory symptoms. Pears also contain dietary fiber, primarily soluble fiber, which is generally beneficial for digestion. However, excessive intake over a short period, especially in individuals with sensitive digestion, may lead to bloating, gas, or gastrointestinal discomfort. Overconsumption can also alter bowel movements, potentially resulting in mild digestive disturbances. Additionally, pears contain natural sugars, mainly fructose. In older adults with diabetes or metabolic disorders, uncontrolled intake may contribute to elevated blood sugar levels, particularly when consumed in large portions or repeatedly throughout the day. Dental considerations should not be overlooked. Although pears are softer than many fruits, older adults with weakened teeth or dentures may still have difficulty chewing thoroughly. Inadequate chewing can impair digestion and reduce nutrient absorption. From a clinical standpoint, pears do not need to be avoided but should be consumed appropriately. Older adults are advised to eat pears at room temperature rather than cold, limit portion sizes, and preferably consume them after meals to minimize digestive discomfort. In conclusion, while pears offer health benefits, improper consumption can negatively impact digestion and overall well-being in older adults. Adjusting portion size, timing, and aligning intake with individual health conditions are essential for safe and beneficial consumption. Dried fruits, such as raisins, dried mango, and dried jackfruit, are often viewed as convenient, shelf-stable snacks that retain some of the nutritional value of fresh fruit. However, from a medical perspective, they are a category of foods that older adults should approach with caution due to their potential hidden health risks when consumed excessively. The most significant concern is their highly concentrated sugar content. During the drying process, water is removed, but sugars and calories remain, resulting in a much higher concentration per serving. This means that even a small portion of dried fruit can deliver as much or more sugar than a larger portion of fresh fruit. In older adults, especially those with diabetes or metabolic disorders, frequent consumption can lead to rapid increases in blood glucose levels and poor glycemic control, increasing the risk of complications such as cardiovascular disease, kidney damage, and nerve impairment. In addition, dried fruits are calorie-dense but not very filling. This can easily lead to overeating without realizing it. In older adults, excess calorie intake contributes to weight gain, reduced mobility, and a higher risk of conditions such as hypertension, dyslipidemia, and heart disease. Another factor to consider is the concentrated fiber content. While fiber is beneficial, in dried form it can become too dense. Without adequate fluid intake, it may cause constipation, bloating, and digestive discomfort. Since older adults often have slower digestion, these effects may be more pronounced. Furthermore, many commercially processed dried fruits contain added sugar, salt, or preservatives to enhance flavor and extend shelf life. These additives can increase the risk of high blood pressure and place additional strain on the liver and kidneys, particularly in older individuals with pre-existing conditions. Dental health is another overlooked issue. Dried fruits are often sticky and can adhere to teeth. In older adults with weakened teeth or poor oral hygiene, this increases the risk of tooth decay and gum disease. From a clinical standpoint, dried fruits do not need to be completely eliminated, but they should be treated as an occasional snack rather than a dietary staple. Older adults should consume only small portions, choose unsweetened varieties, and drink enough water afterward. Fresh fruit should remain the primary source of fruit intake for better nutritional balance and safety. In conclusion, while dried fruits are convenient, they can pose significant health risks if consumed regularly or in large amounts. Careful portion control, mindful product selection, and alignment with individual health conditions are essential to ensure safe consumption for older adults.